Welcome back to the morning show on JTV. Our show today is brought to you by Summit Heights Dental Care. Thank you to Dr. Nick Legow and his entire team.
Joining us now is from the Pulmonary Clinics of Southern Michigan, pulmonologist Dr. Anish Wadwha. Good morning.
Hi, good morning. Happy New Year.
Happy
Thanks for
New Year.
having me.
Happy New Year to you. We were just talking before you came on. I think we should maybe start with it. The Monday night football game. Obviously, there was a horrible situation, a cardiac situation. You've seen the video. You're actually from Cincinnati.
Yeah.
Talk a little bit about kind of what you saw, from your perspective.
What a shocking thing. And, these are things that typically happen in the, private parts of a hospital, so to speak, but this was laid bare for so many people to watch, especially children, perhaps, or, it doesn't make it easier because, I'm a physician, but so many lay people who don't have experience with this kind of thing. So just such a shock. I think a couple things that it made me think about is that, we don't know exactly what happened. There's some reasonable speculation, but we'll have to wait to see what the folks there. I actually went to medical school at Cincinnati. It's a fantastic medical center, and the emergency services that they provide in this city are amazing. But a couple things it makes me think about is that without CPR and training with CPR, obviously there are medical professionals who responded, and an AED, a defibrillator. I think that these are the kind of things that can save lives, and you don't have to be an expert. And so. It's not the time to talk about certain things, perhaps. It's a rough game, whatever that is, in protection. It seemed relatively innocuous, but certainly without those things there, trained professionals who knew how to do CPR and looks like maybe even an AED, if that's the case, these are things that anybody can learn how to use.
Yeah, for that athlete, a lot of trained medical personnel, they're very, very quickly. How important is it to get to a patient that quickly?
When you do life support training, you don't need. It's ideal to have everything, but recognizing you need help is one of the first things that's taught. And the other thing is starting CPR. And medications are sometimes needed in certain circumstances, and a defibrillator if there is a malignant rhythm that's there. But if you don't know any better, and this is, a lot of times if people call 911, and we've had patients who've come in and their family members said that the 911 person coached me through it. And you don't even have to know much except that somebody can direct you and with a calm voice. And in this case, obviously there was teamwork and they practiced these things, but it doesn't take much in terms of special skill, just intent, like you want to help, right? And one person goes to get help, one person starts, or you work as a team. And so fortunately, at least there's a fighting chance, maybe is what it looks like.
Yeah, it's something everyone should know, how to respond, where the materials are to respond to an AED if that's available, trained personnel in the workplace, the procedure, who calls, when to call. That's training that everyone needs, should happen really in every. A collision could happen between two people in a warehouse that could cause arrhythmia and lead to a heart incident.
And the assumption is a healthy 24-year-old, but
right.
Yes, there's the game circumstance, but still.
Yeah.
Well, as a pulmonologist, you're dealing with all kinds of issues, viruses, diseases, sicknesses this year. And we were talking before the show, I had what I believe is, what did I have?
You had RSV.
RSV. So the diagnosis, was tested for COVID, the two types of influenza negative, and the diagnosis was likely RSV. There's nothing that really can be done for it, right?
Yeah. Not much. It's one of those things. It's just we use the term supportive care. Grandma's recipes of rest and liquid, and don't do anything for a couple days, and things you should improve.
Yeah, and it's can be a long recovery. It could be short. There's different, different levels of the virus.
Different intensity in terms of how it hits you. And in the past, fortunately in the past several weeks, the CDC has talked about this in terms of the stats that the number of hospitalizations maybe has improved, at least related to influenza A. That's been the dominant thing. Obviously, in the weeks prior to that, especially into the fall, for a lot of kids, and pediatric hospitalizations were really significant. And I know the excellent group that provides care for kids at our facility here, Henry Ford Jackson, they've been really overwhelmed. And so there's been some improvement. I think maybe this is not as bad as it had been in years past, some of the pre-pandemic flu times, but it's certainly been significant. And whether it's RSV or flu, and there's still some COVID, depends on where you're starting from in terms of how healthy you are if you're vaccinated. And certainly we can talk about that. That's the benefit of vaccinations. It might reduce the intensity or even potential to get sick.
You see people maybe with some pre-existing conditions that these viruses, I mean, they just take hold of you. Asthma, COPD. Talk a little bit about the struggle with a pre-existing condition when you have one of these viruses come in.
We had talked about this in the past. I think we talked about COVID maybe a year or two ago, that in terms of your respiratory condition or your cardiac condition, these are the things, age, sometimes weight, these are things that can lead to more risk in terms of a complicated course for infection. And so I think for those folks who have these conditions, oftentimes they have a primary doctor at least, if not a specialist. And certainly early conversation with your provider to say, okay, this is what I've got, a nurse or a physician may talk to you. Help me keep an eye on this, because then maybe you can tell me what are the worrisome symptoms that say maybe just the basics aren't enough. I've been vaccinated. I'm trying to keep away from my family so nobody else gets it, and to try to mitigate spread of whatever the viral process is. But I think certainly for those who have conditions, being in contact with the doctor early to say, especially if they've got COPD on oxygen or heart disease where they have heart failure, or if they're dialysis patients where they have bad diabetes, these are the kind of things that we think about. Talking to your provider early, a doctor, advanced practice provider, these are all the folks as part of your medical team. They can help direct you and say, you're doing fine. I would venture to say most folks will be okay to take a phone call from a patient, who's worried, and then help guide them.
Yeah.
With this huge amount of respiratory viruses and diseases that we're having, are there any new technologies, new treatments, new protocols in either the discovery or the treatment?
I think the antivirals that exist, at least when we're talking about things for flu or some other conditions, I'm going to hold on saying that I know all of the details about what's available that's new on the market. I was just reading something this morning that said at least if we go back to COVID, the latest variant, which is on the increase in New York City, the bivalent booster is effective against that. So meaning the tried and true things still have their role, and at least for COVID, we know about the benefit of vaccination. For influenza, we know about that. For certain conditions, at least for influenza, there are some antiviral options that might exist. They may not make you, have your symptoms go away right away, but maybe they'll lessen the intensity of it. Certainly for people who have COVID infection, now in the last couple of years, we know which things might be right for certain people. And so these are things that your doctor can direct you. If you've talked about it before, Paxlovid, certain medications at right times for the right people may help keep you from getting hospitalized. But I think the other thing, and this is where speaking with your medical professional is important, is that if it's not the first infection that gets you in terms of getting really sick, it's the subsequent maybe decline in your immunity that would put you at risk for the next infection. And we're seeing that actually quite a bit in our ICUs, that we've had a lot of hospitalizations for flu and then patients who get an infection on top of it. And so although your body might be able to get through the first thing, it's really being aware that the second thing might come around too.
What you offer lung cancer screenings. What age should someone consider a lung cancer screening?
I think this gets back to the same concept of preventative care and preventive care. So I will often talk to my patients who are smokers, who are the guidelines have changed that if you're above age 50, if you have a pack a day for 20 years smoking history, that you should talk to your provider about if cancer screening is right for you. I'll tell patients the same thing though, that if you're a woman who has risk for breast cancer, not doing a mammogram, but doing your lung cancer screening, you're leaving something on the table. For those who should be screened for colon cancer, all of these things have a role. Specifically for lung cancer screening, a lot of these patients who we see in our clinic we talk about vaccinations for them too, because those are just as important. You're trying to mitigate risk. certainly the patients who are smokers age 50, and if you have a 20-pack year tobacco history, that's where you should start to talk about, is screening right for me?
I remember the last time you were here, we talked about new technologies for the lung cancer screen. I understand there's also some new things that you're using, like robotics, and then there's some sort of a bronchoscopic lung reduction surgery. What's that?
I think we have a good multidisciplinary team here in Jackson. Mohan Kulkarni, Dr. Kulkarni, who's a thoracic surgeon you've spoken to. And we have a very big, robust thoracic disease team, oncology, radiology, pathology, pulmonary. The last couple of years, we brought some new technology here that helps us to diagnose cancer earlier in terms of lung nodules, and that's our robotic bronchoscopy system. Going forward, we're looking to kind of offer a spectrum of options for patients who have advanced lung disease. And so one of the techniques that we're looking to start hopefully in the first half of 2023, now that we're here in 2023, is for those patients with advanced emphysema. And there's certainly particular criteria, but for those patients, as a measure to reduce the symptoms of their advanced disease. And so the technique is valves that are placed in the lungs, and this can lessen the physiologic burden of their emphysema. In the long run, we're talking about all of these tools that we can offer for patients here in our community to say, these are the things that are important. At the same time, I'll tell a patient, hey, let's talk about this. I'm going to tell them pulmonary rehab is important, exercise is important, nutrition counseling is important. It's like you got to start the sentence and finish it too. So all of these things are important.
Yeah, so first of the year is the time when a lot of people make their resolutions about their health. Any suggestions or advice on from your standpoint for the health of our lungs and our pulmonary system?
I think we've known over the years that smoking cessation rates, especially in this county, that we've done okay in terms of counseling patients and getting them across the finish line. I think that's certainly, it's always something to keep working at for those who have tobacco addiction, and talking with their providers about what's the right way to move forward with that. For those who have respiratory disease, as we talked about vaccinations, screening for lung disease with basic testing that can be done through a primary clinic or through a specialty office. Talking about exercise, this is everybody's got the resolution at the beginning of the year about I got to exercise more. It's got to be in moderation. Aggressive exercise is not right for everybody, but I think taking the direction from your provider about what's right for you, these are the things to consider.
Yeah. Did you start your exercise yet?
Next week. It's next week.
Next week.
That's fine.
We'll work on the diet first week, exercise second week. Thanks so much for all you're doing for our community and for being here today.
No, Happy New Year to you. Thanks for having me, and hopefully that kid does okay.
Yeah, I hope so too. Dr. Anish Wadwha, MD, here with us on the morning show. We'll be back after this quick break.